This segment of the Plastic Surgery Channel is brought to you by Galatea, now offering Galaform, the first 3D mesh for soft tissue support.
This is No Spin Live, and do we have a show for you today? We're going to talk about Jane Fonda is not happy, mini facelifts, what are those, and a labia necklace, unbelievable. So with us here today, we've got, starting with Dr. Jason Posner from Boca Raton. JP, you guys recovering from that hurricane?
We are post-hurricane, although it seems like a hurricane out today, pouring.
And we got Dan Del Vecchio from Boston, Massachusetts. Is already starting to snow there, Dan?
No, nice autumn day in Boston.
And Tiffany McCormick from Reno, Nevada. Tiffany, what's going on? You guys had any aftermath of the Las Vegas stuff there?
Yeah, a lot, but we're all donating a lot of blood.
Yeah.
That's helpful.
Terrible stuff, huh?
Yeah.
All right, and then finally, last but not least, we've got Charlie Mesa from Weston, Florida. Charlie, you guys also dealt with the hurricane recently, huh?
Yeah, we did, but we were lucky because we're a little further west from the coastline, so it wasn't too bad here, thank God.
Yeah. All right. Well, let's get into it. This is the hot story on Jane Fonda. She was on to have an interview, actually, her and her buddy, Robert Redford, with Megyn Kelly, and apparently Megyn Kelly wanted to ask her about the work she had done, and Jane Fonda didn't think that was a good idea. So, Jason, lead us off. What do you think?
You know, I'm like questioning why they even bothered asking her about it. This wasn't an interview about plastic surgery. This was an interview about her work. I didn't think it was relevant to the conversation they were having. And if she wanted to bring it up, I mean, she could bring it up. You know, they talked about Robert Redford, you know, and whether he had any work done. I think it wasn't quite the right venue. And if she wants to discuss it in her own time, in her own interview, I think that would be, you know, completely appropriate. But I thought the push for Megyn Kelly was a little bit off.
Yeah, I think the quote was, she said, like, I know that you've had some work done, but you don't like to talk about it. You're not proud of it. What do you think? And then Jane Fonda said, do we really need to talk about this now?
I think Megyn Kelly's trying to make a story more sensational, and plastic surgery always gets people's interest, and everyone knows that Jane Fonda's had work done. She's been public about it before. It just wasn't the time or place. It's her personal decision to have it done, and when she did it, and she spoke about it before. This is just Megyn Kelly trying to up her ratings, and it was very ineffective and awkward when she did it.
Tiffany, I mean, should we really even care if Jane Fonda's had anything done?
You know, I have to agree with what everyone said in that it wasn't the appropriate time or place. And of course, Jane's been really open and honest about this in the past. The one good thing for us as plastic surgeons is I actually think she looks great. And it's, you know, she's a great role model for certain women to see, to know that facelifts can look natural and help you look amazing. So on that end, it's a positive. But I don't think anyone out there didn't know that she's already had plastic surgery.
Del Vecchio, never short on opinion, and you're a big Megyn Kelly fan too. So Dan, what do you think?
I'm going to go down to my basement in my bureau and dust off my sock drawer and get 1992 Jane Fonda Buns of Steel video. Jane Fonda actually preempted BBL by about 30 years with her Buns of Steel video. She looks great, and if she doesn't want to talk about her plastic surgery, more power to her.
All right, well, let's move on to the next story. This is we get lots of emails from our viewers, and they're always asking about what's the difference between a mini facelift and a regular facelift or some other type of facelift, lunchtime facelift. So we need to sort this out for the viewers. So Jason, start us off.
You know what? I read the article, and I actually know the doctor who wrote this article, facial plastic surgeon up the street from us. So, you know, it's trying to compare a facelift versus a mini facelift. I think these are all variations on a theme. It's basically the same surgery with similar incisions. And I kind of look at it as, if they need a lot of work, it's a facelift or a neck lift or a rhididectomy or a cervical facial rhididectomy. If they need a little less work, I call it a mini and I charge them a little less.
I think it's really confusing for patients, especially when they hear, you know, lifestyle lift or lunchtime lift. I try to break it down similarly to how much work they would need as an individual. And instead of saying mini or full, I'll often say short scar versus longer scar. If somebody has a lot of excess skin that needs to be displaced elsewhere, then, you know, they're going to get a longer scar up behind the neck. If there's not a lot of extra tissue for me to have to work with, then it's a shorter scar. But I try to make it clear that I'm still dealing with the underlying tissues and SMAS and lifting and repositioning of tissue, other than just skin, either way.
I think the three components to facelift One is the amount of surgery you need to do to get the result. 2 is the price. And 3 is what you tell the patient it's called. And that's a fluid dynamic. So if the patient is sensitized to mini facelift, you still may end up doing a lot of surgery that we wouldn't consider a mini facelift. But if you want to do that case, you're going to call it a mini facelift. But I try to be fluid with the patient and let the patient talk first, because if you let the patient talk enough, they'll tell you what they want.
There's probably a place for a more minimally invasive facelift for some patients, and then other patients obviously need maybe a bigger procedure to get the result they need. So how do you explain it to people?
I think it's about managing expectations and then trying to find exactly what bothers a patient and addressing that in particular. Some people might just want a little bit of tightening along the jawline. Some people want their neck tighter. They want more volume in their face. It's a multifaceted approach to facial aging, and it really depends on what the patient is looking for in terms of their own individual goals.
Okay, I think that's some really, really great info. All right, so the final story is a crazy story. Came across our desk, and we had to put it on No Spin Live to get you guys' take on it. But this is a patient in Britain, they must be taking something weird over there because they're always doing crazy stuff. But this patient apparently had a labiaplasty done, but she saved her labia, got the labia, and then made a necklace out of it she wears around. So I've not heard of this, although there are sometimes patients will say, I want to get my breast implants if they're going to have the breast implants changed out or things like that. But I've never heard of this. Jason, what do you think?
I don't know about this one. You know, it's like another person looking for a sensation. I mean, maybe Dan still has his foreskin around his neck, something like that. But sounds good. You know, it's like, look, I'm with Bill. If someone asks for the breast implants, we'll cook them and sterilize them and give them back to the patient. But I really am not in the, giving body parts back to the patient that we've taken out. Maybe next will be someone who wants to like frame their fat that we took out. I think it's a no, and I'm going to give this a thumbs down.
Tiffany, what's your take on it?
One good thing came of it in that, she really explained why she had it done and the irritation she was experiencing. And she brought up the point that not a lot of women talk about this or know that this is something that can be fixed. And so, she kind of had me there on a good note until she started talking about the jewelry. And then I thought that was a little weird. Not the strangest thing I've heard, not even today. But I've heard of people trying to do things with body parts and yeah, that's taken it a little too far. But, she's bringing attention to the procedure and maybe we all need to be talking about it more.
Del Vecchio, is this just attention grab on social media or is this the real deal?
This is attention grab on social media. I mean, I remember this friend of mine, and his mother had her gallbladder out, and she asked for the gallstones and put them in a little jar on the window, and I thought she was a freak. We'd have to look into that, but it's weird. So Charlie, Valentine's Day, labia necklace, are you buying this?
No, of course not. And like Tiffany said, the only good thing out of this is that she did say that she was, chronically plagued by discomfort and brought more awareness to the procedure and performing it for reasons other than just cosmetic, and that's why it's an increasingly popular procedure. But I think, I don't know how she got the skin in the first place and what surgeon would hand it over to her. I think that's inappropriate and it's a little bizarre.
You're not going to see any of these type of insights anywhere but No Spin Live, and those are some great ones from you guys today, so thank you. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.